Hey guys, how are you? Today I want to show you a failed implant site. So let's take a look at the axial view, and you can clearly see there is a osseous defect at the site of missing tooth number 3. This area has failed to fill with bone, and you can see this area in the coronal section. Again, the buccal cortex is intact. Palatal cortex is very thin and possibly perforated at the site. But most importantly, I want you to see that the floor of the maxillary sinus is perforated. So now let's take a look at the sagittal view of that area, and there you have it. So here again is the site of missing tooth number 3. I don't have a whole lot of patient's medical history. What I do know is this area, the implant was initially placed, and after some time this area failed. The implant failed, excuse me. So yeah, I just want you to show you what happens after the implant is extracted. Also keep in mind that there is a partial sinus subpatient here as well. Another interesting feature in this patient's case is this radio-opaque entity. What is this? Does it look like a brain to you? So this, as you might know just from the anatomy, what you're seeing is maxillary torus, a very large one, obviously. And again, I just kind of want you to see the overall density, the radial density and shape of the torus. It's very sclerotic. It has very similar density that of cortical bone. It doesn't have a whole lot of trabecular bone in this particular case. Not only that, it has this kind of two halves that are meeting at the mid-palatal suture or intermaxillary suture. And yep, that's what we have here. So let's look through that in the axial view as well, and in the sagittal view. So you see how it's attached to the hard palate. And let's go to the other half, and again, a large prominent maxillary torus. So I hope you found this video to be interesting, and I know I have not been able to post some videos for the past 2 to 3 months, but I plan on posting the videos on a regular basis, and I hope you can continue to learn from these interesting cases that I see on a daily basis. Thank you and take care. Bye.